BPH stands for benign prostatic hyperplasia, or essentially prostate enlargement. And as we age, men, our prostates grow year after year after year, about 1 to 2% by volume every single year of our lives. So as we start getting older, our prostates start growing and closing off the outflow channel, and we get the classic male symptoms. They'll notice that they stand to urinate and they have to wait. So hesitancy of urination, weaker stream, start, stop, dribbling afterwards. Weaker stream, frequency, and urgency are the most common things that you see. So most men assume today that their only options for prostate enlargement and urinary symptoms are medication or surgical procedures. Since 2015, there is a fantastic new procedure available that avoids the operating room and is about 6 to 7 minutes, that uses the power of steam energy to open the prostate channel and get the patient back to voiding as they did when they were 30 years old, but without medications or surgery, and with little to no side effects. Resume is an in-office procedure, so you don't have to undergo anesthesia. You're not in the operating room, you're not staying overnight. It takes literally 6 to 7 minutes at most in the office. It's a procedure where we numb the prostate first. So we do an ultrasound of the prostate, we use lidocaine to numb the prostate, we put numbing lubricant down the urethra, and through a special scope, the scope has a deployable plastic needle, and every centimeter down the length of the prostate, we inject steam. It is literally opening up that channel with something as simple and powerful as steam. We inject just under a milliliter of steam every centimeter down the prostate in the left lobe and the right lobe. It's not an immediate fix. We have to put a Foley catheter in afterwards. That prostate is going to swell a little bit, and what we don't want them doing is not being able to urinate afterwards and winding up in the emergency room. What actually happens is that steam energy destroys, it kills off the transitional zone, the section of the prostate around the tube that we urinate through, and that will retract. Our bodies will reabsorb that tissue, and that channel then retracts wide open. That doesn't really happen before 3 to 4 weeks after the procedure. So a catheter is placed, we send them home, we get the catheter out 3 to 5, sometimes 6 days later, depending on the situation of that individual patient. But it's really fun when you get them back 4 and 8 weeks later, because when you get to 6 and 7 and 8 weeks, that channel now is opened up, and the real benefits, the side effects of doing the surgeries in the operating room, you don't have any of that. So you have no ED rate, you have no retrograde or backwards ejaculation rate, which a lot of these younger guys that are on Flomax, it's a great option. They get off their medications and they have really no downside. So it's a fantastic procedure, just using the power of steam. The 4-year data has a 96% success rate. I just can't tell you, at 5, 6, 8, 10 years, we may need to do something else. But that's how easy the procedure is. Game changer. It has been a revolutionary treatment in the last 5 years in BPH worldwide, yes.